My last dental exam was probably 5 months ago, so I have another one coming up. And then I just get canker sores here and there, but no issues.
Okay, and you had your tonsils out.
Right.
All right, and have you had any lumps in your neck, enlarged lymph nodes, swollen glands, neck pain, stiffness, limited range of motion?
No.
Okay. For your breast, have you felt any lumps, pain, discharge, rashes, any history of breast disease?
Nope, no history in my family, and I do a self-breast exam like once a month. And
Good.
No, nothing abnormal.
Okay, you should continue to do that, and then eventually you'll have your mammograms scheduled. You're not there yet. Okay, any cough, productive or non-productive, any shortness of breath, wheezing, any history of lung disease?
No.
And you've had a TB skin test for your job,
Yes.
correct? Yeah.
Yep.
But no x-rays?
Right. The last test was the beginning of this year.
Okay. And any issues with your heart, palpitations, chest pain, cyanosis, any murmurs that you have a history of, or hypertension?
No. The only time I get that chest pain and shortness of breath is when I'm flying, but if there's no flights coming up, I feel okay.
Okay. And no history of hypertension?
Right.
Okay. And then your appetite, has there been any changes in your appetite?
I do eat a lot of spicy foods, and that gives me heartburn.
Okay.
I try to avoid them when I can, but I really like spicy foods. And then I do burp a lot after I eat. I think I eat too fast.
Okay. And do you take anything for heartburn?
Sometimes I'll take Tum.
Okay. Okay. That's good.
Okay.
You don't take Zantac?
No.
Okay. I think that's off the market now.
Oh, okay.
Okay. And then are you experience any like frequency or urgency with your urine, incontinence, any issues at all, bleeding?
Nope.
Okay. No history of STDs?
Nope, no history.
And you've been tested?
Yeah, whenever there's a new partner, I get tested, but I've been with my boyfriend for a year.
Okay. And then how about PMS symptoms?
I do get a headache. Sometimes I get a little moody around my period.
And how many days does your period normally last?
About 5 days.
Okay. Any issues with your vascular system, like coldness or tingling, numbness, leg cramps, varicose veins?
No.
And you have no history of blood clots?
Right.
Okay. Or ulcers?
Right.
For muscle, do you have any muscle or joint pain, cramps, history of arthritis, or limitation of movement?
You know what? Ever since I started taking Accutane, I do have a little bit of joint pain. I noticed that my yoga practice is a little bit more difficult than prior to taking Accutane.
Okay. And I think that's another symptom that they explained to you, right? Your dermatologist?
Mm-hmm. Yeah, I see them once a month.
And then any history of seizures, syncope, weakness, paralysis, numbness, or tingling?
No.
Okay. And then for mood disorders, you just have the history of depression,
right?
Correct? Okay. And do you have a history of anemia?
No.
Okay. Any easy bruising or bleeding?
I do get bruises easy.
Okay. And then any lymph node swelling?
No.
Okay. All right. How about any intolerances to heat or cold?
No.
Excessive sweating?
No.
History of diabetes, thyroid disease?
A family member my dad has diabetes.
Okay.
So.
But nothing with you. You've had no issues.
No.
Okay. Any hormone replacements you've done?
Birth control.
Okay. You're on birth control. You've been on birth control for a while, right?
Right.
Okay. And then lastly, this is all about mood and your psych. So you have anxiety, depression.
Yes.
Do you feel nervous at all?
I do. I feel like ever since I started seeing my psychiatrist, I feel a little bit better. But once again, with airplanes, there's really no controlling that. It's pretty severe.
Okay. And then any memory changes?
No.
And then any attempts of suicide or suicidal thoughts?
No.
Okay. All right. I think those are all my questions.
Okay.
Thank you.
Thanks.